Namaskar. I'm Dr. Manoj Mahajan, Director of Oncology Services in the Department of Medical Oncology and Hematology, Pacific Medical College and Hospital, and also founder of Cancer Care Clinic in Udaipur, Rajasthan. Today we'll be speaking about the blood cancers. There are many blood cancers. Few of them are very aggressive. Few of them are indolent or slow growing, and many of them have potential of complete cure if treated timely. So today we'll be talking about CLL, chronic lymphocytic leukemia, which is a type of blood cancer. It can have different manifestation. It can present like symptoms. I'll brief about it. Usually there are three kinds of symptoms. The blood consists of three major components. First is hemoglobin, which has a normal range of around 12 to 15. Females have a little lower range. So when a blood cancer happens, hemoglobin tends to fall. It falls to very extremely severe low levels, up to 4 or 5 gram of hemoglobin, which is very low. Usually in iron deficiency or nutritional deficiencies, we see a drop of hemoglobin up to 8, 9, with exception in severe patients, it can go very low. But in blood cancers, it often drops down to 4 or 5. So, person requires repeated blood transfusions for the same, and despite multiple transfusions, patient's hemoglobin does not stay or does not hold there. The second line which is affected in the blood cancer is our defense system, often denoted by white blood cells, and normal count is 4,000 to 11,000. So in blood cancers, many of the blood cancer, this WBC count goes in lakhs. Like it can be 1.5 lakh, 2 lakhs, 3 lakhs. So despite the high number, high quantity, it does not necessarily mean the quality is the same. So what the quality of normal 11,000 or 4,000 will not necessarily have the same quality in the blood cancer patients. So they have defective army or dysfunctional defense system. So that is why such patients are very much prone for the infections. So they usually get repeated infections like pneumonia or urinary tract infection. They can have multiple infections in a very short period of time. So if such thing is happening, especially in the elderly, so you need to have a suspicion of blood cancer and need to look for. Not necessarily it is a blood cancer, but it is definitely need to look for. And the third component is the platelet. Platelet we often hear in dengue, these platelets go very low levels. But there are other causes also which can cause low platelet level. Normal level of platelet is normal standard is 1.5 lakh to 4.5 lakh. And when this platelet levels go below 20,000, 10,000, it is very critical things. Platelets are normally required for healing. Whenever we get cut, the platelets clogged up and they form a thrombus and they heal the cuts. So when that level is very low, it can cause bleeding from anywhere. It can cause internal bleeding as well as external bleeding. Internal bleeding can cause in any organ like brain, lungs, and external bleeding can occur from the orifices like the nose, mouth, in the blood. Blood can come in the urine, blood can come in the stools. So this is the external bleeding. So platelets are essential for this, and all these three components can be affected because of the blood cancer. So these are the common symptoms associated with the blood cancer, and it can happen in most of the blood cancer, including CLL. And there are other symptoms which are like patient can have neck nodes or swellings in the neck, swellings in the axilla, then spleen can increase in the size. So these are the other symptoms. Patient can have severe weight loss and severe fatigue. All these are related to the blood cancer. And if combination of these is happening to anyone, we should suspect blood cancer and need further consultation and evaluation. So let's take a real life example of one of my patient who has gone through this blood cancer or CLL and experienced the deadliness of the disease, and he has taken the treatment and now cured and he is a potential survivor. So let's hear from him.
मैं रमेश चंद्र जैन ऋषभ देव, राजस्थान उदयपुर डिस्ट्रिक्ट का रहने वाला हूँ। 2017 में अहमदाबाद से डायग्नोस हुआ था ब्लड कैंसर का। वहाँ से ट्रीटमेंट नहीं मिला था। अभी 2019 में 2020 में मेरे को ज़्यादा तकलीफ हुई। उदयपुर में 3-4 हॉस्पिटलों में मैं घूमा, अहमदाबाद भी घूमा, कहीं से ट्रीटमेंट नहीं मिला मेरे को रेफरेंस मनोज महाजन जी का, डॉक्टर मनोज महाजन जी का रेफरेंस मिला, मेरे बेटे को मिला। हम यहाँ आए, डॉक्टर साहब से मिले और इनका जो ट्रीटमेंट हमारे चला, करीब 5 महीने हो गए इस बात को। उसके बाद हमको काफ़ी आराम है। बाकी इससे पहले हमको करीब 30-35 यूनिट ब्लड लेना पड़ा था, तो काफ़ी तकलीफें झेली। यहाँ आने के बाद में हमको कोई तकलीफ नहीं हुई। 5 महीने में हमको कभी 100 ml भी ब्लड नहीं लेना पड़ा और आज मैं बिल्कुल व्यवस्थित हूँ।
This patient I'm talking about, the blood cancer patient, he was diagnosed in 2017 as stage 0 blood cancer. There are multiple types of blood cancers. Few are very good, few are very aggressive. So he had a CLL, it's chronic lymphocytic leukemia, it's type of blood cancer again. So which is most of the time, if treated timely, it can get controlled in very well manner, and in some of the patient can be cured for long term. So this patient presented to me in 2020. Though he was diagnosed in 2017, he was under follow up, and he couldn't continue to follow up, and he didn't continue any treatment till 2020. When the COVID started, after the COVID era, he had presented to me in a very severe condition where his blood pressures were low and he has severe infection. For that, I needed him to admit in ICU. We started the care with giving broad spectrum antibiotics, medicines for increasing his blood pressure. His kidney was also slightly damaged because of the low blood pressure. With that, with all medications, he improved. His kidney function also improved. And once he stabilized, then we started the treatment for the blood cancer. By the time when he reached us, he had already received 35 units of blood for low hemoglobin because of the blood cancer. And when we started the treatment, since the treatment, he has received just 2 units of blood transfusion at the outset, probably way back in September, August, September. And then once the treatment was started, he never took the blood transfusion subsequently. So he had given 6 courses of chemotherapy and targeted therapy, and to which he has responded wonderfully, and he is now free of transfusions, blood transfusions, and he is not on any medications. After 6 months, we had done few more tests to confirm about his disease, and all the tests are within normal limits. So apparently, his disease has responded very well to the treatment, which he should have taken quite earlier. Thank you for watching the video. If you like the video, please share and subscribe to the channel. If you have any feedback, please comment on the comment section. Stay tuned for the next video to learn more and live more.